Our second panel session, the first talk is going to be about skincare, aging gracefully, and maintenance. And Dr. Bajaj is going to talk to us about that. Dr. Parker is going to talk to us again about hormone replacement therapy this time, other options and treatments. So we're excited to hear about that. And then Natasha is going to talk to us about love and intimacy.
So, did she or didn't she? Secrets to aging gracefully. And so, one question that everybody has is, what does it mean to age gracefully? Is it anti-plastic surgery? Is it having too much plastic surgery? And I actually had a patient yesterday who said that to me. She's like, I always thought I was going to age gracefully, and plastic surgery seems really extreme. And that's probably because when we think of plastic surgery, we think of bad plastic surgery. And the reality is, good plastic surgery is the plastic surgery you don't see. And that's aging gracefully. In general, as we've learned, things like sun exposure, an unhealthy diet, and whether or not we take care of ourselves has its effect on us, including genetics. And we do age, and our faces do change how they look with time. And there are things we can do to age gracefully. And that's sort of what I want to talk about today, in addition to defining what is. I think of aging gracefully as more of an attitude. It's how you carry yourself. It's about being confident in who you are and living your life the way you want to. And I think these are some examples. Helen Mirren has aged beautifully. Jane Fonda has aged beautifully, and she's actually embraced plastic surgery, and her outer self reflects her inner self, and that's important. That being said, one of the things I talk to all my patients about is the importance of daily maintenance. Think about it this way. If you went to the dentist once every 6 months and didn't brush or floss in between, your dental visits would be a disaster. And the same thing is true for all of your aesthetic treatments. One single aesthetic treatment, whether it's 30 minutes, 4 hours, 2 hours, is not going to reverse what you have done for the past 20, 30, 40, 50, 60, 70 years. And so that's why I refer to it as the 80-20 rule. In reality, 80% of what you can do to look good comes from you. And the other 20% comes from what I do or other types of aesthetic treatments. One really well-known plastic surgeon actually put it this way, and he practiced in Dallas and was really well known for facelifts in the 70s and 80s. And he said, no matter how fine the tailoring, you still have to deal with the fabric. And that's kind of true. This is a pyramid kind of making the same point. And as you can see, that the top layer is the more advanced things if we're going to talk about skin treatments. So this is something I posted on Instagram comparing how I feel like I've aged over the past few years. And most of you may not know, but I'm 55. And, I think it's important as we think about aging, what we can do to improve it. And when people ask me what my secret is, I usually say, well, I'm a plastic surgeon. I have everything at my disposal, which is kind of true. So to that end, we have a group of female plastic surgeons, and we always talk about what we can do to age gracefully. And we did a survey on our Facebook group page and wanted to ask female plastic surgeons, what are the top 10 things you can do to age gracefully? And most of it is stuff that you already know. Number one is sunblock. You have to remember that sunblock is important to protect your skin, and it's going to protect against UVA and UVB rays. And you really need to use it every day. And as we discussed, it should be a minimum of SPF 30. I think it's important when you use sunblock, it should be titanium dioxide or zinc oxide, which is an actual barrier. So don't do the drugstore sunblocks or sunscreens. Do real medical grade sunblock. The next thing would be intentional eating and weight maintenance. I think it's really important that all of us find the nutritional plan that works for us. I'm not going to say diet because diet is temporary. The nutritional plan is how we can live our lives every day and eat the things we want to. And I do believe that there are certain foods that some people can tolerate and other people can't. And you have to find what works for you. And it's important to maintain your weight. As we've discussed already today, gaining weight puts you at risk for cancer to some degree. And also gaining weight wreaks havoc with your skin and elasticity and your tissues and all of that stuff. So weight maintenance. And then, of course, toxins and fillers used judiciously. There are many brand names out there, but I think it's important that you use them judiciously. One thing that most people don't realize is that Botox was first used for medical indications. It didn't get approved for cosmetic indications until 2002. And we used to use it for spasm and all strabismus and multiple medical uses. And now people only think of it as a cosmetic treatment. So the way Botox works is it decreases the wrinkles that are caused by animation. So as we grow, as we age, our skin loses collagen and elasticity, which means it has less ability to bounce back, which is also partly why weight fluctuations can be so detrimental. But it's also why, as we age, those wrinkles become more and more permanent, sort of like when you take your coat to the cleaners and that crease gets ironed in, and no matter how much you straighten it out, you can't. And what Botox does is it weakens the muscle, so hopefully those deep inset creases don't happen. And we usually use it in many places. Most of you are probably familiar with your frown lines, your forehead. We can use it on your neck for your platysmal bands, your frown, right here, which I call my resting bitch lines, anything. The other thing that's really common is obviously fillers. That's another important treatment that all plastic surgeons partake of. Most people don't realize I've been doing toxins and fillers on my own face since I was 30. And so I still think I look fairly natural. So when they're done appropriately, they have the ability to look natural. Hyaluronic acid fillers are the most commonly ones used. There are multiple brands and there are multiple types. And the molecular structure and water absorption capacity determine where we inject them and how deep we inject them. The reason fillers are important is once we reach our 30s, the cruel joke of aging is everywhere else on our body, it becomes more and more difficult to lose weight. But we lose volume in both our superficial and deep fat compartments in our face. And then that compounded with the natural loss of collagen and elasticity in our skin ages our face and begins to give our faces a more square appearance. So fillers are usually performed, in the office. They're pretty straightforward, usually use topical and ice for local to numb you up, and it's pretty comfortable. I would be remiss if I didn't mention these are medical procedures, so choose where you go wisely. Obviously, the risks with Botox are more temporary since it only lasts about 3 to 6 months. Frequently, you can get ptosis or spread of the toxin. We've also heard recently in the news when people have had counterfeit Botox, which is not good. Fillers do have the ability to be more problematic. If you have intravascular injection, you can have tissue necrosis, blindness, and multiple other complications, including hypersensitivity reactions and infections. So number 4 was deep tissue massage because it feels good and it relaxes you. Number 5 is another thing we've also discussed, which is weight training and exercise. Remember that as you age, you lose muscle mass, and to maintain it, you have to stay active. And that's also going to be critical for nutrition and weight maintenance. Easy, drink enough water. None of us are good at it. I don't. I'm in a chronic state of dehydration. As we talked about the basics of good skincare, I'm going to put in a plug for medical grade skincare because I think that's important as well. That's how you maintain your skin. One of my patients asked, well, what's the difference? It's just more expensive. But there is a difference. It has higher quality ingredients. The ingredients are more concentrated, allowing for deeper penetration. And they have FDA oversight, which means when medical grade skincare makes claims, they actually have to follow through with those claims. Decrease alcohol intake. As we've discussed also, that decreases your risk of cancer. Hang out with people you laugh. and do the things that you love. Find your passion and live your life, because that's the way you're going to age gracefully. And the final one, I find that as I get older, I need more sleep, but we're going to talk about the sex component. But one of my friends who's a plastic surgeon was like, don't ever forget about the great sex. I was like, okay. And my take is have a great pair of shoes. So I guess what I just want to sum up is aging gracefully is about what you do every day to take care of yourself. And then the aesthetic treatments are the icing on the cake, because I do believe when you look good, you feel good. And when you feel good, you look good.
Well, I'm going to do my best to be present with you because now I'm thinking about my work and my little children and how little I sleep and the impact it's having. Um, they asked me to talk about hormone replacement. And I think it's really important to kind of clarify what hormones we're talking about. Because in general, like just when we talk with each other, we say hormones and we mean something very specific and something very female. But the truth, and usually it's kind of not very nice. You're hormonal, so you're being crazy or you're being irrational. But the truth is, hormones are just chemical signals that tell our bodies to do certain things. When we talk about hormone replacement therapy, specifically those female hormones are estrogen and progesterone. Those hormones are produced by our ovaries, and they kind of have a lifespan that's shorter than the human lifespan. So, for most American women, the average age of menopause is about 51. And when an OB-GYN says menopause, we mean that it's been a whole year since you've had a period. It's been a year since your ovaries have produced eggs and produced estrogen. Um, Now, that said, our lived experience in our body of menopause is a little different. There's that perimenopausal period a few years before and after, and sometimes the rest of your life, where you may experience symptoms of lower levels of estrogen. Estrogen is a hormone that before menopause you make while you're growing an egg. And then as you go through menopause, your ovaries kind of stop making it, and it has effects on our brain, on our breast, on our skin, um, and on our uterus. Um, Specifically, in terms of like our brain, there is a center in our brain that regulates our temperature regulation. So that's kind of the most common thing people complain about, is that they have these hot flashes that all of a sudden, and it's not just that you get hot more easily than other people, it's all of a sudden you're kind of hot from the inside out. And that comes from low estrogen levels. Estrogen replacement therapy is a good way of treating those symptoms. Unfortunately, estrogen tells the lining of your uterus to grow, so just taking it by yourself increases your risk of uterine cancer. So, when people still have a uterus, if you haven't had a hysterectomy and you're having menopausal symptoms, we prescribe estrogen, and we also prescribe a second hormone called progesterone. Progesterone kind of mitigates the effect of estrogen on our uterus and prevents it from developing cancer. There was a big clinical trial looking at the safety of hormone replacement therapy back in the early 2000s. And the media really kind of covered it in an unfortunate way. And it made a lot of people really afraid to take hormones and afraid of hormones, that they were bad for their health. And the truth is, there are some risks. There is an increased risk of coronary heart disease. There's a slight increased risk of breast cancer and an increased risk of stroke that we learned from this study. However, when you looked at women who just initiated hormone replacement therapy around the time to the transition of menopause and didn't wait more than 10 years to start these medications, their risks were quite a bit lower. So I think with anything, you kind of have to balance the potential risks that might be small and then your quality of life. I see some women who go through menopause and they never have a single hot flash. They just stop having their periods one day, and they never really know about it. And then I see other people who have terrible hot flashes multiple times a day into their 70s. And so that's just not really sustainable for life. And so what we know, and what my professional organization recommends, is an estrogen, and there are pills, but they don't tend to be as absorbed as well. If your insurance will pay for you to have a patch or a transdermal, like a gel, that tends to work a little bit better. And then the progesterone is a pill. I typically recommend that people take that progesterone to prevent endometrial cancer at night because it does make you very sleepy. I have a handful of patients who don't have hot flashes anymore. They don't want to take their estrogen anymore, but they will never let go of their progesterone because it helps them sleep so well. So, FDA approved estrogen and progesterone is kind of the main, most helpful treatment for menopause. Unfortunately, the data shows that it really helps with those hot flashes. Some of the other more distressing symptoms of menopause, like the brain fog or the skin changes, the hair changes, the joint pain, the clinical trials don't really show that it helps as much with those. Now, that said, anecdotally, I feel like a lot of my patients do feel much better, report better mood, feeling sharper. There are some non-FDA approved hormone replacement therapy options. I think they are really good at advertising that involve giving systemic testosterone and what they call bioidenticals, which are not bad, but they are kind of made to be like more natural and closer to like what's natural in our system. And the truth is, because they're not FDA regulated, we don't always know exactly what's in them. And when they test these, a lot of times they don't even have very good levels of the hormone that you're hoping to get. So that's not to say that sometimes people don't feel benefit. I do have patients who regularly get some of these kind of off the books treatment and feel really good, and I'll never convince them not to do it. But what we know is safe is that estrogen replacement therapy. I'm trying to think if there's anything else. So I think that we talked about some risk factors, but if you initiate your hormone replacement therapy around the time of that transition to menopause, those risks are fairly low.
Well, first, I wanted to say that I feel so empowered today listening to everyone on this panel. So proud to be a woman and empowered to get all my screenings and do all my due diligence. I'm here to talk about what is sex therapy and why you would want to see a sex therapist. I am Natasha Langhans. I have been licensed since 2008 as a marriage and family therapist. I'm originally from California, so I practice there and I'm licensed here and in California. 2 years ago, I started my journey being really curious about the sex field and getting a specialty in sex therapy. I'm currently in a PhD program, and yes, you can get your PhD in sex. So that's yeah. I'm in my second year working on my dissertation, and I just love what I do. So, what is a sex therapist? It's a licensed professional that has been specially trained in sex, in sex challenges, in sexuality, in hormones, and in sexual health. Let's see, sorry. Um, in sex therapy, I help people identify and work through sexual challenges such as low sex drive, pain during sex, religious trauma that has affected you throughout your life, difficulty having orgasms, and sex difficulty after injury or illness. There's so many reasons why people come in for sex therapy. I just help you improve your overall sexual satisfaction. So, why would you need a sex therapist if you are looking to have a conversation that's non judgmental and safe with like a trained professional? So many issues that we talk about, including intimacy, cancer and sex, body image, menopause, sex and aging, sexual trauma, or any other challenges with your current sex life. So, what are the most common reasons why people come into sex therapy? You might be wondering. The thing that I see most often is sexual discrepancy, desire discrepancy, which is one partner would like more sex than the other partner. So, I would see a couple for that and discuss discuss like what's getting in the way. And there could be a multitude of reasons. So we do a very thorough sex history for both partners, and discuss, what are parts of your history that could be getting in the way of desire. I just help clients to feel great exactly where they're at. A few sex therapy tips that I find helpful for clients during the different seasons of their lives. One is the difference between automatic and responsive desire. So when we are younger, or what we see in movies is this automatic sexual desire that you just see someone and you're automatically turned on and you want to have sex. But that is not most people's reality. And so educating clients, educating each other on responsive desire and what that actually looks like. And what that looks like is being in a situation where you're open to pleasure and you're open to connection. And so that's the more of a realistic reality of desire. And if you want to desire your partner, you already have desire. So many women come in confused. I don't feel like having sex. I'm not sure if I'm normal. And you are normal. You just have to kind of navigate what's getting in the way of where you particularly want to be. Another important fact that everyone should be aware of is that only 20 to 30% of women reach orgasm through penetration. And I think this is something that we don't talk about enough, and something that, you can talk to a sex therapist about, or do research on your own. It's common that women are confused and they think, well, there's something wrong with me. There's absolutely nothing wrong with you. And so learning more about your own body, and being able to communicate that with your partner is key. There's just so much that to learn and discuss in this field, and I'm absolutely loving it. I love working with clients. If you're interested in working with me, or I can help you find a sex therapist, my office is actually located in this building. Yeah. So thank you guys all for being here. And yeah, let us know if you have any questions.
Thank you, ladies, very much for your talks and talks about aging gracefully. And one of the reasons that we brought Natasha in here is that if you don't know, most patients with breast cancer are placed on a hormone blocker, and that blocks your body's production of estrogen. And not only the stress of having breast cancer, but the stress of all of the things that go along with not having estrogen and relationships. And so we really appreciate just the opportunity to have you here. So we're going to do questions and answers again. So here go the hands. All right, we'll go back here first. Whoops, I'm going to go to the back.
So I had a hysterectomy, oophorectomy earlier in my late 20s. So something I struggle with, I mean, the hot flashes, all of that, but the desire part of my life, the desire to engage in, sex and things of that nature. Is there like a magic pill that you can take, or is that, I mean, does that ever come back around, or is that just part of the
It's kind
process?
of a question for both of us, probably, because it's complicated. It's not just one thing. There is a very hormonal chemical aspect to sex and interest in sex. And, that's something I talk to patients about who are maybe on birth control pills, and that suppresses your ovaries from ovulating, or if your ovaries have been removed and you go through early menopause because of that. To some degree, our brains tell us that we want to have sex because they're trying to trick us into getting pregnant, and we've released an egg and like this is the time. And if you don't do that anymore, sometimes you don't get that like spontaneous chemical signal. That's another thing where for some people, hormone replacement therapy can be really helpful. It's not true for everybody. And, I think I briefly mentioned testosterone not having a really obvious place in hormone replacement therapy for women. The little bit of data that does show that there is some benefit is in spontaneous sexual desire, though. So that's maybe something to talk to your doctor about. There's probably not a magic, but there are some medications that exist to help with, low sexual desire. One is a daily pill you take, and I think it's a very safe pill. I think in the clinical trials, they found that people had 2.5 additional satisfying encounters a month. I don't really know what half means, if it's half an encounter or half satisfying. But I've had a couple patients take it and feel like they had really good results. There's also a medication that's a little injector, and you give yourself like a little shot with a pen, and it creates a sexual desire for 4 hours. I've had a couple patients feel like that was successful too. But I think you make a good point. Like, if you're even kind of wanting to be interested, that's the first step. Do you have any?
Yeah. Well, thank you for asking. I think that as women, we have so many responsibilities and we just put our desires on the back burner. And so you absolutely deserve to have the sex life that you want, the intimacy that you want. And it might look different than it did in the past, and that's okay. And so, as as if we work together, we would definitely do all the medical, like, refer to a doctor and rule out all the medical things. Those things can definitely help. And then we would discuss like things that are getting in the way, whether it is your view of self, your view of your body, your the way you view yourself as a woman, and go from there, and just get some realistic goals to where you want to be.
Okay, thank you, ladies. Another question from somebody? I'm going to go this way. Here you go.
How long can you take hormone replacement therapy? Like, to what age?
That really, if you read the book as a little baby medical student, what they say is to take the hormones for 3 years and then pause and see how you feel. About half of women, whether you cold turkey stop your medication or you wean off of it, are going to have hot flashes again. Really, the key to the safety, if you don't have other risk factors, of hormone replacement therapy is starting it around that transition. So if you're one of those people who you try to stop taking your medicine and like 5 years later, you're immediately back to that terrible place you were before, you just keep taking it. I have a pretty low threshold for letting people continue their medication. It really depends on your symptoms.
And another question. I came to this side. Here we go.
Does dietary or oral collagen help your skin?
Not really. But if it makes you feel good, you can do it.
Another question.
Okay, my question is for Bajaj and Dr. Parker. So I'm a little curious because the older I get, the more I notice like I have this kind of acne around my bottom like jawline and stuff. And I know that Bajaj, you were talking about the medical grade like skincare and stuff like that. But for us broke girlies that don't really have a lot of money and we're struggling, teenagers, she takes all my money. So I'm curious, like, um, what would be a good alternative if you cannot afford the super expensive? I'm assuming it's really expensive, which I know it'd be worth it, but like I said,
It's somewhat expensive. I mean, we do specials all the time, and it lasts a long time. But then I would do the basics of good skincare, right? Cleansing, hydration, and moisturizing, and sunblock. Those are the fundamentals that you should do, and you should cleanse your face twice a day. I mean, how many times do we all just go to bed without washing our makeup off?
sometimes.
All the time. I mean, sometimes. The other thing is the other trick is don't use hot water because that's going to increase oil production.
Okay.
Don't use hot water. It's going to increase your oil
thought-
production.
I thought it was supposed to like open your pores and like get all the junk out. Like, that's all just bullshit? Like, okay, got it. Thank you.
Okay, we'll do one more.
So I'm seeing a lot, especially on social media, about baby Botox, and you should start getting Botox in your early 20s. And is there any?
So
Is that
the
real?
idea behind the preventative Botox is that you start early so you don't develop those deep set wrinkles that are ironed in that you can't get out. I mean, you can do it. It's totally up to you because you have to remember Botox only lasts 3 to 6 months. So are you ready to start it in your 20s? I don't know if you can afford it in your 20s either. I mean, I don't know. I started in my 30s, but I had access to free Botox all the time, right? Um, the thing is once you're 60 or 70 and you want to get Botox, by that time your skin has lost enough collagen and elasticity. Those wrinkles aren't going to go away. They'll get softened with the absence of movement, but they're not going to go away.
Okay.
I was just going to ask a question about menopause. I ask you questions all the time. But so if you're having symptoms of menopause and we're going, oh, okay, I'm having hot flashes or my periods are getting irregular, is there a test? Do we just like take a test
That's
and
a
go,
really good
oh, good, check
question.
mark, I have like strep or something, is there a menopause test?
There are people who will test your hormones, and a lot of them will charge you cash for their special test. And you do get some information. The thing is, hormones, like the female hormones, fluctuate so much even throughout the day. If we check it first thing in the morning and then later that day, you're going to get a different number. So it's a little bit hard to interpret what that means. And then once you've been through menopause and you're not having periods anymore, I already know that your estrogen levels are going to be really low and your progesterone levels are going to be really low. It's a hallmark of menopause. So there are tests. They don't really help us decide how to take care of you. If you had a question, like there is a test also called the anti-Mullerian hormone, AMH, and it's sort of a rough estimation of ovarian reserve, like how many eggs we may have left, like how much life is left in our ovary, but it hasn't really panned out to be as helpful for treating people as we hoped it would.
So follow-up question on the symptoms, and if you're having other symptoms, are you, like with breast implant illness is a common topic right now. Is that on the agenda? Are we going to even talk about that?
That is not on the agenda. We're going to have another one.
Yeah.
Okay, ladies, we're going to take another break.